Indications from the federal government suggest that Lassa Fever outbreak in Nigeria has claimed the lives of 132 persons in 2022. Minister of State for Health, Senator Adeleke Mamora, disclosed this at a ministerial briefing on COVID-19 response and other health-related developments at the Federal Ministry of Health, Abuja. Mamora, who raised concerns over the rising trend of the disease, said out of the over 3,000 suspected cases in 23 states across the country, 681 have been confirmed. The minister further reeled out several response and intervention efforts by government to address the situation.
Lassa fever confirmed cases seem to be on the rise, as the present fatality rate is 19.1%. Part of government's response to Lassa fever is the enforcement of environmental sanitation and focus on long-term improvement of water, sanitation and hygiene facilities to eliminate or reduce cholera.
As expected, the minister also gave a breakdown on COVID-19 and measures put in place by the government to sequence the virus by the end of April 2022.
As at the 11th of April 2022, the reports from Nigeria Center for Disease Control reveals that about 255,468 Nigerians tested positive to the virus, with 2,719 cases being active, while 249,607 people have been treated and discharged. And sadly, so far, we have recorded 3,142 deaths. COVID-19 safety measures have also been revised with effect from April 2022. And this includes mask wearing in enclosed environments that is strongly recommended, and personal discretion is advised in open places.
Meanwhile, the Director General of the Nigeria Center for Disease Control Ifedayo Adetifa and other speakers debunked insinuations that COVID-19 is on the rise on some states across the country.
There was a report of a 45% increase in case numbers for a period, it said the first 9 days of the month, which was from the 1st of April to the 9th of April. And the basis for that report was using absolute numbers, that in the preceding week there were 182 cases, and then it went up to 265 by April 9th. Using raw numbers without denominators, what we call, when you say 182 of how many? As you know, what it means is that if you can have exactly the same percentage positive depending on what the denominator is, and the denominator was not taken into account. So this headline is untrue. We have not seen a 45% increase in cases. Test positivity rate has stayed at 0.2% in the 2 epi weeks that we've counted for this month. So please,
we have the federal government, the state, and the LGAs with our partners and other stakeholders commence or finalizing an integrated micro plan and work plan that will see full integration of the COVID, RI, and other PSA services, usually for the supplemental immunization, like talk about the measles and yellow fever, and also polio. And this has been ongoing. We also remember that we did discuss that in 2022, we're going to have a lot more vaccines, and we set a target of really achieving 70% by the end of 2022.
Other takeaways from the briefing indicate that as at April 2022, over 13 million eligible population have been fully vaccinated out of the expected target of 111 million, 776,503. CNN News.